Okay, so this is my presentation of protecting nurses to protect patients. This is basically about the nurse burnout, and I don't know how to insert my voice into certain slides because I am not going to be talking for this whole presentation, but I am going to be talking on some slides, and some slides I will be completely silent and let you read it for yourself. So let's continue. So the problem is obviously the nurse burnout is unsafe and that the staffing levels are major and the growing problems in healthcare systems across the US is growing rapidly. But nevertheless, the major problem is that there is nurses having burnouts because there is too many patients for them, and it's just a very hard workload for them. Okay, so who is affected by this problem? Uh, so obviously the nurses are affected, but also patients and families are affected too. The reason being is because if a nurse, can't really handle their patients, then it's putting the patient's health in danger. And with families seeing that the nurse is not able to take care of their loved one or their friend or whoever their connection is to them, it grows, it makes them feel anxious and frustrated, showing that the nurse is not able to handle them. So I did an interview. I did two interviews, but this interview is a man on the street, more like women on the street. But I had interviewed Cambry Lout. I had basically, asked her if she has ever heard of nurse burnout, what does she think about it, um, and everything like that. So these are the four things, she had basically said about each of those questions was that burnout increases errors, reduces patient attention, and harms teamwork. High patient loads limit safe, quality care. Balanced staffing improves focus and outcomes. Staffing shortages worsen burnout and delay care. And mental health support is key to sustaining nurses. So she is, Cambry Lau is a psychology major. And in short, she is, basically like how I said before, this is how she felt, and short term, summarized questions of what she had said about the questions I have asked her. Um, so moving on. So a proposed solution that I have is that hospitals to kind of help the reduce of nurse burnout is how they call it is safe nurse to patient ratios. So, kind of basically, these changes would improve the nurses' working conditions, and it will hopefully, lower stress, um, and overall, it'll be safer for the patient. So the next interview I had did, I was supposed to interview an alumni, but was unable to reach them. So I had looked for an article that of a person that does work in the medical field and has experienced nurse burnout and has done the research of what to help to prevent it. So the main thing she had said in her article was research makes clear that doctors' performance and the quality of care patients receive are affected by their workload. A similar pattern is true with nurses. Their higher workloads are associated with higher death rates among hospitalized patients. So, meaning it is true that it is unsafe of nurses having nurse burnout and still working, because if they continue to work with that nurse burnout, then they are lacking into attending, the patient's care, which also causes them to miss minor things that could end up to leading to a death, with making the death count more higher. And then this here is a TED talk of a nurse that had experienced nurse burnout and the whole process of how it started, how she felt during the burnout, and what she did to help herself. But obviously I won't play it because it is a long video. So the next one is basically the counter arguments against the solution. Plain, full on plain little title here. So some people are arguing that ratios are too expensive and that the burnout is a personal issue. But however, these views ignore evidence that unsafe staffing increases turnover and medical errors, leading to higher long-term costs and worsen outcomes for both nurse and patient. So the next thing is call to action of what people should mainly focus on about the nurse burnout and what to prevent it. So hospitals and policymakers must address nurse burnout and unsafe staffing by implanting staffing ratios and mental health support. These changes improve working conditions, strengthens patient care, and ensure better outcomes. Immediate action is needed to prevent these problems from worsening. So people in the medical board that work in each hospital need to bring this to their attention, because the death rate of each patient does tend to worsen with any nurse being in the nurse burnout, because they do end up lacking in seeing minor problems. Even though they may seem minor at the time, they could later on be major and be a cause of death. Then here is my sources of where I got them and my two interviews that I had interviewed. And then that is it. Thank you.